Hi, my name is Rhonda Wyskiel, and I am a Hopkins nurse. And for those of you who can't say that, I wish you could say it because I want you to know how good it feels to say it because it makes me feel proud. It makes me feel proud both professionally and personally. I've been a nurse here for 17 years throughout various parts of the hospital, and I feel lucky for that. And I'm going to share with you a very brief story of what patient and family-centered care means to me. You see, my mom was sick very early in my nursing career, back when I was a nurse on Nelson 8, so long ago. And I remember being a part of that journey with her, not as a nurse though, but as a family member, walking through the community hospital where we started, moving here to Hopkins where I thought things were just going to be perfect, and then ultimately back home. And I remember being so dismayed in that journey as a family member and not a nurse, and getting a lot of lessons in that journey, lessons that I learned from over time. So my mom isn't with us anymore. She died actually from some medical errors, not necessarily here, but in all parts of her care. And I took those lessons learned because they changed the way I looked at care and the care that I was going to deliver as a nurse. And I knew I worked in a place that craved innovation and supported clinical staff like myself to they supported us so much that we made patient and family-centered care a strategic priority. So I took that lesson back to my unit where I worked then, which was the Weinberg Intensive Care Unit, where I had amazing leadership and insight from my team, and I helped to create a tool from my lessons learned where we could engage family members in a way that was meaningful, a way that would engage them as part of the healthcare team to offer them opportunities to provide some of the direct care that we provide as clinicians. And that intervention has now become a key intervention in a project, a very large project called Project Emerge that's funded through the Betty and Gordon Moore Foundation. And we're very proud to say that we're learning a lot through that intervention called the Family Involvement Menu. And it's supposed to be going live actually this week in the surgical ICU here and further at Bayview and then at UCSF. And ultimately, we hope that it goes live in many institutions nationally and internationally. You see, without the spirit of innovation and the commitment from leadership in Johns Hopkins, the commitment to partner with patients, families, and our loved ones to eliminate preventable harms and optimize patient outcomes and experience, this might have never happened. But because I was inspired and supported by this institution, I took my own personal experience and I helped to create something with a team that might make the difference for each of you. So I get to travel some for my work now, working with the Armstrong Institute, and I get to go to a whole lot of institutions and see a whole lot of different faces and a lot of different nurses and healthcare professionals. And I always feel like when I'm in the crowd that I stand out. And I don't stand out because I look different, but I think I stand out because I'm a Hopkins nurse. And I feel as if I'm illuminated in a crowd of people because I'm a Hopkins nurse. There's something special about working here. And it really does feel like part of my family. So thank you all for your commitment to all that you do. And I'm proud to call Hopkins my home.